My name is Denise, and I'm an insurance agent in Tucson, Arizona, specializing in Medicare supplements, Part D drug plans, and Medicare Advantage. I created this presentation to give you an overview of your Medicare choices, and there are actually many choices to make about your Medicare coverage. But first, let's review how Medicare works. Medicare Part A covers hospitalization, skilled nursing facilities, home health services, and hospice. It has a deductible, but no monthly premium. Part B pays 80% of doctor bills, ambulance charges, emergency room charges, and many other non-hospital medical services. Medicare Part B has a monthly premium. It has a deductible, and you pay 20% of all Part B bills. There is no cap to your coinsurance. Medicare only as a choice for your Medicare coverage is not really a good choice because you pay 20% of your Part B bills, and there is no cap on your 20% coinsurance. 20% of chemo and radiation therapy can add up to $10,000 or more. And if you're chronically ill for a long time, 20% of all those doctor bills, well, that's the kind of thing that can put people into bankruptcy. So to avoid ever-growing and never-ending medical bills, you can get a Medicare supplement. And then you might want to get a Part D drug plan. A Medicare supplement fills the gaps in Medicare. It can be used anywhere in the U.S. because it works alongside your Medicare. Medicare pays first and your supplement pays second. The plans don't have fancy names, but they have letters. And each of these letters represents a plan that fills the gaps in Medicare in a slightly different way. Plans C and F are the most popular plans because they cover most of the gaps in Medicare. M and N were introduced in 2010, and they have lower premiums because you pay copays. When you go to the doctor, for example, there are a few other copays as well. Premiums for Medicare supplements in Arizona range from about $75 to $150 per month. The one negative about Medicare supplements is that premiums do go up over time. Now, if you get a Medicare supplement, you should get a Part D drug plan. These are bought through insurance companies. Premiums range from $17 to even more than $75 per month. And you need to make sure that the plan that you select covers your prescriptions. There are 40 or so Part D plans offered in southern Arizona, and they each have a different formulary, and some prescription drugs are not on many of those plans' formularies. You can only change your Part D plan at the end of the year, so choose wisely. And now let's take a look at your Medicare choices. As I said, you can get a Medicare supplement and a Part D plan, or there is another way to get your Medicare coverage, and that is through Medicare Advantage. These plans are also called Medicare replacement plans. Medicare Advantage plans are offered through insurance companies. They usually include Part D, and most are HMOs, which involve a local network. And most HMOs will require that you get a referral from your primary care physician in order to see a specialist. There are some PPO plans out there that allow you to go out of network for a slightly higher copay, and these plans do not require referrals from your primary doctor. Advantage plan premiums are lower than Medicare supplement premiums. And that's because Advantage plans require copays for doctor visits and all of the medical services you receive. Arizona still has Advantage plans with zero premiums. So one more time, let's take a look at your Medicare choices. So now that you understand a bit about your Medicare choices, you need to decide which type of coverage is best for you. Do you feel more comfortable on the left side of the screen here or on the right side of the screen with a Medicare Advantage plan? And here's a bit more information for you to consider. I like to say that with a Medicare supplement, you're paying in advance. With Medicare Advantage, you're paying as you go, and that's because of all the co-pays every time you see a doctor or get a test or end up in the hospital. So now here's a bit of bad news, because this is just the first decision that you need to make about your Medicare coverage. There's actually quite a bit more to consider, and that is, what company will you get your coverage through? And this is where you need to work with an insurance agent like me. The next slide gives you some idea of the number of choices that you have. If you are considering a Medicare supplement, these are just 3 of 20 to 30 companies that offer Medigap plans in Arizona. Medigap plan is another name for Medicare supplement. And I mentioned earlier that there are 40 or more plans for Part D in Arizona. If you're considering Medicare Advantage, these are the major players in southern Arizona. But as you study these companies, you will see that they offer several different types of plans. Humana offers an HMO and a PPO. CareMore offers special needs plans for people with diabetes and breathing disorders. Secure Horizons has several plans, although they are also eliminating their private fee-for-service. SCAN will be coming to Pima County this year. Universal is still going to have its private fee-for-service plan. Now, if you're considering Medicare Advantage, here are some questions. Are your doctors in the plan's network? Or are you willing to change your doctor because the Advantage plan you're considering has very low copays or maybe offers some benefits that you want? What is the annual cap on your out-of-pocket expenses? Some plans will have a cap of $6,700 in 1 year. Another plan might have a cap of $3,000 or even less. The Part B coverage of the Medicare Advantage plan, does it cover your prescriptions and at what cost? And these are just a few of the questions you might have. So I hope this presentation has been helpful for you, but it is really meant to get you thinking about your Medicare choices and all the questions you might have about your Medicare coverage. And hopefully it will make you feel comfortable with the idea of working with me. I'd be happy to answer any questions you might have in general about Medicare or specific questions about the companies or plans that I've mentioned here. So give me a call or email me. And thank you for listening.